Hello, Namaste. This is Dr. Satyendra Katewa. I'm a pediatric hematologist, oncologist, and bone marrow transplant physician. I work for SHALBY Sanar International Hospital, Gurugram, Delhi, NCR capital region. Now, sometimes for few diseases like leukemia, aplastic anemia, thalassemia, sickle cell anemia, somebody is going to come in and say, your child needs bone marrow transplant. So I'll try to explain in the next 3 minutes what exactly is a bone marrow transplant. So before we go into the bone marrow transplant, we understand what is a bone marrow. Now inside our bones there is a hollow space, and in those spaces there is a thickened blood which we call bone marrow, and inside that bone marrow there are some stem cells which make all the blood cells. So those cells, because they make the blood cells, we call them hematopoietic stem cells. Now in common language, if you want to change this bone marrow with some other bone marrow, we call it bone marrow transplant. But in scientific language, because we are changing those hematopoietic precursor cells, hematopoietic stem cells, in the scientific language we call hematopoietic stem cell transplant or hematopoietic precursor cell transplant. Both are one and same thing. Now it can be of two types: autologous bone marrow transplant or allogenic bone marrow transplant. So once you want to wipe out, or you want to clean, or you want to kill the existing bone marrow of the patient, and then you replace it with the bone marrow of patient himself, which you have collected before the procedure started, you call it a autologous. Means patient's own stem cells are used to be work again as a bone marrow. But if you are using a healthy donor whose stem cells we collect in the operation theater or in the blood bank, and then we give it to the patient, we call it a allogenic bone marrow transplant. So bone marrow transplant is of two types: autologous bone marrow transplant or it's allogenic bone marrow transplant. And in allogenic bone marrow transplant there are three subtypes. One is matched sibling or matched related bone marrow transplant, which means there is somebody in the family whose HLA is matching with the patient. It is matched related or matched sibling bone marrow transplant. If that is not there in the family and the family is keen on a 100% matching transplant, we search for a donor in the registry and we call it matched unrelated donor transplant. And if that is also not there, or we do not have time to do the search, then we just do a 50% matched transplant, which we call haploidentical bone marrow transplant. So I hope this will take away a lot of your questions, that what exactly is a bone marrow transplant, and that makes you, it gives you some comfort that you know what you are getting into. Have a great day. Thank you.